Meghalaya state has been taking a lot of initiatives to bring a lot of health reforms and also to build health systems. So as part of that initiative, we have come here to learn from Thailand.
Thailand is one of the best health models which we have, and we wanted to understand better so that we can implement those ideas, suggestions, what they have done, what the kind of activities or actions they have planned, policies what they have made, how they have approached public health as a whole. So we have already sent 2 batches. This is the 3rd batch which is going, and with this I think there will be more than 100 people who would have visited.
Thailand and India are very close friends and civilizational neighbors, and we are close partners in the ASEAN region. What strengthened our relationship over several millennia is exchange of ideas and knowledge.
Today I introduce about DMA. DMA is an organization, Bangkok Metropolitan Administration Organization. And another is a Trivatana District Office at my Public Health Center 67 Trivatana.
This is the model for by church, and she developed to health tool, and this is a handmade for anatomy. And when you suction this suction, it connect the water and suction.
Here in Bangkok, only when we call public health center, we have doctor as a director.
The things that we use as the principle of Thai healthcare system, and when we try to develop and strengthen our healthcare system in Thailand, we based on this 2 principle of the social determinants of health. And the second one is on the health system actors. On the left hand side, we call this is the social determinants of health, mean that the factors that can affect on health of the population.
So with regards to my state in Meghalaya, we have those 2 sources of funding. One is the state share and one is the central share.
The major expenditure comes from the state budget. We spend about 8% of the state budget for healthcare. So a part goes for insurance, but a lot of money goes for public health infrastructure.
On behalf of the NHCO, I would like to thank the team from Meghalaya for being interested in the work of NHCO and the policy process related to health.
In 2019, Thailand enact the primary healthcare system with aim to increase the number of family doctors and expand primary healthcare unit to reach every Thai citizen.
What are the challenges in getting people to participate and find?
The challenge is to get involved people into the process based on my experience. For example, how to select the right person to implement it.
National Health Assembly is the good study because when us let people like 3 parties like academic, government and civil societies interact each other, actually they learn from each other. We let learning from doing rather than teaching.
Ladies and gentlemen, on behalf of the Department of Health, it's my great honor to welcome all of you to our department.
to promoting nutrition in Thailand, we closely align our strategy with global nutritional and health targets.
Does government provide nutritional food to those students between 0 to 3 years of age group?
Now we have the policy and program to implement the nutritional care in child center to take care the baby below 2 years or so.
It is a great pleasure and honor for me to welcome our delegates from the state of Meghalaya. Training course of Village Health Volunteer Community Health Manager. We promote them to act as like a manager, health manager at the community level.
So the concept that we are running right now, we have family care. And this family care team, actually the VHV role is accompany with the team from the community hospital.
If you have uncared elderly people, do not have any family members to take care of them, and if you have any government special homes to take care for elderly people,
or if that family didn't have anyone else, then the trained village health volunteer trained as a caregiver also can taking care. And that is another kind of the thing that the government provides support.
Welcome again to Ratchaburi province. In every district of Thailand, we have one main hospital like here, and we have a lot of health centers.
A pregnant woman coming from those households, difficult terrain, how did she been brought from there? In a stretcher?
1669 not only from the hospital, but including local political government. In case of remote area, the local political government, they can pick them up to the hospital.
This is a shirt of Village Health Volunteer. I respect them because they help us very much in terms of promotion prevention.
As a frontliner at the PCU, the Primary Care Unit, they do screening. If it gets positive, then they refer to the community hospital for certain investigation until they send for treatment.
This building is got the LEED award. Is leadership in environmental and energy saving design. Yeah.
This is one we can see that actually health is not just about doctor and patient relation anymore.
The budget of Thai health come from tax. We call sin tax, right? And it's come from the products that cause harm to people, like a tobacco or the alcohol base.
So the beautiful part of that entire health financing is that we could see that almost like you are able to achieve a very good universal health coverage, and also your out-of-pocket expenses is one of the lowest in the world. So I think so that's something very appreciable. It's only 11% or 10%, something like that.
This exposure has allowed me to see a lot of new things. A few takeaway points are the village-based health volunteers.
And I feel, from my side, I feel the immediate takeaway is that how we focus on the health prevention, like what we saw on the Thai Health Foundation today.
I was really amazed to actually see the kiosk that are there stationed outside each of the health centers.
Your people are very disciplined. These are the things that are contributing to the well-being of the health and well-being of the people in your country. The things that we need to go back home and teach our people.
On behalf of ASEAN Institute for Health Development, thank you for your presence and active participation, and we are pleased to hosting you as well.